For most of us, the sight of maggots, even in a movie, is enough to make you grimace. But for Connie Johnson, maggots may be the last way to avoid a partial foot amputation.
Then you think about it and you say, well, either you have your foot or you do it.
This has been open now for a few weeks.
Connie already lost a big toe to an infection and poor circulation in her foot, a common problem for diabetics. Now a wound an inch deep won't heal, and an infection is making it worse. Dr. Alan Kalker convinced Connie to give maggots a try.
Maggots are remarkably surgically precise. They won't eat anything that's not really grossly unhealthy.
The idea of maggots as a limb-saving treatment surfaced during the Civil War. Injured soldiers sometimes laid on the battlefield for days. Surgeons found wounds infested with maggots healed better than those which weren't. Dr. Kalker prepared Connie's wound, then dropped about a dozen hungry maggots inside. He covers the wound quickly so the maggots won't crawl out.
Oh, mercy. I'm going to throw up. I'm going to throw up.
As the maggots eat the dead flesh, they excrete an enzyme that kills bacteria and stimulates growth of healthy tissue. Doctors who use maggots boast 80% of maggot-treated wounds have all the dead tissue removed, compared with 48% of wounds treated surgically. But it's still not a widely used treatment.
Doctors don't like to do it for the same reason patients don't like to do it. They're squeamish.
After just 48 hours, Connie returns to have the maggots removed.
I don't have any feelings in my feet, but in my mind, I think I can feel something.
The maggots have grown several times their former size, and Connie's wound shows significant improvement.
If you look at the wound, it's got some nice, pretty pink tissue in there today.
Connie's wound will need a second round of maggots, but Dr. Kalker says Connie's progress is promising.
I just hope and pray that it works. If it's going to work, it's going to be a miracle because I don't want my foot cut off.
When you're faced with those options, a little squeamishness can be a lot easier to handle. Ross Kirchis, 5 Eyewitness News.